Greetings, everybody. Welcome to Tuesday, December 12th, 2023 Advisory Board of Health meeting. It is currently 5:03. First order of business is to review and approve the previously submitted September meeting minutes. Any objections? Okay, I will take that as approval. We will get those posted. Report from the Director of Health, David.
Yeah, first, I think that we need to set the 2024 meeting.
Yes, you're right. I skipped a piece there. Yes, so we will plan to return to in-person meetings. Does 5 o'clock still work for folks? David, is that okay with you or?
Yep.
Yeah. So we'll do 5 p.m. and I'll send out. David, did we do that already? Did we set the schedule?
It's the 12th. I got, second Tuesday of the month would be March 12th, June 11th, September 10th, and December 10th.
Just say that really, really quick. March 12th.
June 11th. September 10th. And December 10th.
Got it. Okay, perfect. Okay, now we're officially going to go to the report from the Director of Health.
All right. First thing I wanted to mention, do a staff update. And I think the first thing that I wanted to let you know about is my plan to retire at the end of this fiscal year. So my last meeting would be June 11th. I've spoken with our town administrator, Kate, and start making plans on how to transition. But it'll be, I've been here for 15 years, started in 2008. And it's time. It's my time to take on the next step in life. So wanted you to know and that we're making this plan. Also, in conjunction with that, Paula has also told me that it would be her intent to leave also at the end of the fiscal year and or transition out if it worked out that way sooner. So Paula and I will be leaving this fiscal year at the end of this fiscal year or by the end of this fiscal year. We're considering the thought about replacing Paula. And since we're not doing clinics, do we actually need a nurse, or can we use somebody who has more epidemiological background to do more work with immunization planning, not necessarily doing the clinics themselves, but encouraging and doing health education programs. There's several grants that are available in opioid prevention as part of the state opioid settlement. So, if broadening and diversifying the services provided by the health department. Had some conversations with Kate, and I know I've broached it to the board before about having the health department play a broader role in community health. The other thing that we're doing, which I'll get to in a little bit, is the health needs assessment. And once we're done with the health needs assessment, we'll have to move on with the community health improvement plan. And that would seem to be a role that somebody who's in either the public health nurse or that kind of epidemiological position may be able to kind of spearhead activity in. So thinking about diversifying the staff. As you know, we have been searching for a full-time sanitarian to add to our staff to help with our burden with respect to new development in town. We've advertised it for a considerable period of time, and we've had an applicant who has fulfilled or meets all of our criteria: fully certified, registered sanitarian, and we've offered the position to this person. There's been some negotiation back and forth. It's taken longer than I'd hoped to get somebody on board, but that's part of the way it is. And so we offered the position to this individual who, I guess, as of a conversation that we had today, has accepted. So now we go through the vetting process, doing reference checks and security checks and so on before that person is officially brought on board. So if all goes well, hopefully sometime in January, we'll have that full-time sanitarian added to our staff. Currently, to provide us with coverage for new developments in town and plan reviews, we do have a new temporary part-time food service plan review specialist, Ken Rubano, who's phenomenal. He's he's got years experience in food service, and he's been helping out for the new facilities that are coming on board. We received the pod in the box. We've got our trailer, and it's up in the property at the transfer station. Nick is going to start working on outfitting it, painting the interior. I know this isn't the best time of year to be doing that, but he's got some heaters he can do. He can work around heaters, and he's going to paint the inside and then build some shelving before we start stocking it. But we're making progress there. So, and we still have our part-time food service inspector. We're still hanging in there, and I hope he hangs in for a while longer, because we absolutely need his help. It's critical at this point. So that's my staff report. So development continues apace in the town of Darien. New facility plan reviews, plan revisions, site visits. We continue doing all of that, overseeing the construction process. And one of the things that's so important about having a new full-time sanitarian on staff is to have the same person do the plan reviews as is overseeing the construction process, and then viewing the facilities when they're in their completed state. Right now, we have a slight disconnect because our plan review specialist does not come and do the actual physical inspections. So he sees plans and somebody else sees construction work. It's going to be so seamless to have that work being done in-house, and really looking forward to having a person on staff working full time. 6 new food service establishments opened since the last time we've met. It's been a challenge because these establishments
I was wondering when that would happen. He froze a little while ago. we'll give it a minute and see if he dials back in. Hopefully he does.
I missed that recorded piece. Some of that didn't get recorded. I'll quickly review that where we froze. Time for permit renewals. We're utilizing the FDA food code, reclassification of food service establishments, and fees. But because with our new portal that allows for online payments, it's been pretty seamless. The facilities are really sending in applications quickly. It's also the first year that we've ever had where none of the facilities, according to the tax collector, are in back tax or have back taxes owed, because we can't issue permits to any facility that owes back taxes. They're all up to date. So, any questions about food service? Food service program. Oh, ratings. We're not ready to reinstitute ratings. I'm hoping to be able to do that before the end of the fiscal year. It's got to be when we have our staff fully integrated with understanding in FDA food code, first of all, and then coming to some matrix where we can figure out how to give an A, B, and C when the inspection form does not have a score. So that's our challenge. So we're really not ready to reinstitute ratings. In the meantime, there is a QR code that's posted on every facility, plus on our website. You can go there and review actually, a year's worth of inspection summaries are available for each facility on our website, not only for the restaurants, but also for the cosmetology salons. So the information is available. We just don't post ratings on the facility itself. Any questions about food or cosmetology? I did want to try bringing up the, do you see the screen, am I sharing my screen appropriately?
You are.
I see it. I see a PDF or a QR code.
Yeah, okay. So the health needs assessment. We're making progress. I sent you earlier an email that contains some of the graphics for the community partner survey, and also a summary of what that was. But we're also have just finished what we plan to utilize as a community survey for residents. And there's the link that is there. And I would encourage you all, as Darien residents, to take the survey and let me know what you think. Christine, I think we incorporated, if not all, most of your suggestions and comments. Thank you. But this is ready to go. So we're going to send it out. It's going to go out in the At Home Darien newsletter. It's going to go on our website. It's going to go out in the Selectmen's newsletter. We're going to circulate it to our partners that contributed to the survey. We're going to put it in media and any other places that you could think of. Senior Center newsletter, to try to get it out to as many people as possible. With the intent that we'll start reviewing the information. It goes through January. So we'll have a month that this will be out and about for folks to review and participate in. In conjunction with that, once we're through with the survey, then we go through the state data, for chronic disease, and this report will be finalized in the spring, hopefully in May. Any thoughts or comments? I think the survey flows really well, and I'd be curious, and I'd be curious to hear your input and your thoughts about how it was arranged and the type of questions. We asked a fair number of questions about COVID because we wanted to see, impacts from that. If it's changed life, I mean, I think it has for some of us, and the impacts of that. And we also asked more questions about mental health than our consultant said that she's ever had any other locality who's done the health needs assessment ever asked before. So we're more broad and actually dug in deeper on some issues than she's seen it be done in other locations. So, thoughts or comments?
Looks good, David.
Thank you. With respect to COVID,
just a quick thing, David. Have you shown this to the selectmen yet?
No.
Okay, because they're going to be very intrigued with it.
Yeah, you're the first ones that,
Okay.
We just finished it today. So, being that, the meeting is tonight, I just wanted to share it with you today. And then tomorrow, we'll forward it to the support of selectmen. Yes.
Last night, John made a lot of comments about, mental health, and it was directed, to all the schools and whatnot at town hall. And I think he's going to be very interested in this.
Okay. Yep. All right. But, the final revision to this was made this afternoon. So this is really hot off the presses. Okay, so moving along. COVID is still in the news. COVID is still here. We have plenty of test kits for anybody who is interested in getting any. They're free. And, we continue tracking positive laboratory test results. We obviously don't get the at-home test kits, so we are with the test results that are being reported through laboratories or doctors' offices. That's only the very, very small tip of the iceberg, I'm sure. I think what the state uses more to track the COVID impacts are hospitalizations due to COVID, and those numbers are still fairly low. But we're still tracking on a weekly basis case counts, and the biggest since July, the largest number of positive cases that we've had was last month. We had 7 reported cases in November. So to kind of wrap things up a little bit, I guess once again, we have free radon test kits. Made arrangements with the state health department and offer free radon test kits to residents while supplies last. We got 75 kits this year. So While they're there, come and get them.
What percentage of those get returned, actually, David?
We set a record statewide last year. We had almost 60% return. And what I mean by setting a record, it was the highest across the state. You know, and that's it, in tribute to our office administrator who hounds people. You know, she calls, emails, and reminds and cajoles people to follow up on it. So our return rate has been pretty high. The town has revised the webpage, and so I encourage you all to take a look at the health department website and review it, see if you have any suggestions for improvements. One of the things that I think that we're trying to do is to explain to people what we as a health department do. And to that end, there's a really good video that was produced by Channel 79 featuring our Mindy Chambrelli describing the role of the environmental health sanitarian and the work that they do in the field and how it impacts everyday life. It's a 3-minute video, but we have more that we're planning and hope to have some others there soon. There's another video that has to do with radon and how to do radon testing. And finally, we have been, we'll be receiving correspondence from the consultants doing the investigation of arsenic contamination remediation at Great Island. So I'm looking forward to reviewing the data on that. And that's my report.
David, so there had been some remediation efforts at Great Island, and we're waiting for the results of those efforts?
Yes.
Okay. Does that include that planting of those certain plants and?
Yes.
Okay. Okay, good. Anything else, gang? Okay, David, we still got you for another 6 months, right?
That's the plan.
Okay, all right. I think that's it. Our next meeting will be on Tuesday, March 12th, 5 p.m. in-person town hall, correct?
Yes.
All right. So that is it, unless anybody else has anything else. Great. Have a wonderful holiday, everybody. Thank you.
All right. Thanks. Best
Thank
to you
you.
as well. Take care.